Thank you all so very much for being here. I'm very proud to lead this bipartisan package with Representative Slotkin and so many of my colleagues from both sides of the aisle. I particularly also want to thank the staff and the folks on Energy and Commerce, because we moved these bills through subcommittee and got them to the floor. And it's been tireless work. Biodefense must be bipartisan, and that's why I'm particularly glad to be here with my colleagues from both sides of the aisle, because the American people need to know that biodefense must be bipartisan. It's no secret that COVID-19 has exposed the weaknesses in our nation's public health infrastructure. That's why I'm proud to be a part of this act, which brought together a host of a number of bills, and we hope it will dramatically improve our nation's ability to respond to these threats. From the beginning of the pandemic, I would say all members of Congress, but certainly I've been in close communication with hospitals, with doctors all over the district, and over again, they did say that the Strategic National Stockpile, which I might add, most Americans had never even heard of until the pandemic hit. But what they were relying on wasn't coming through. They didn't have enough masks, gowns, and they were concerned about ventilators. Many of the doctors selflessly chose to continue serving their patients and their communities even when they didn't have the proper equipment to keep themselves safe. And we owe them eternal gratitude. But just as importantly, we owe them our commitment that we're going to continue to push to reinforce our nation's public health infrastructure. The National Stockpile did what it could based on the funding that it had, which was clearly not enough. There were too many constraints, and it's our responsibility to make sure that we must fund these programs at much higher levels. By giving the stockpile the ability to keep its inventory up to date and replace unneeded or expired items, we're ensuring that our doctors, nurses, and frontline folks have the PPE and supplies they need to do their jobs. But even in a perfect world, a stockpile actually cannot have enough inventory to respond to every conceivable threat out there. That's why I'm so proud of Congresswoman Dingell and Walorski and their bills to really focus on the domestic supply chains and the manufacturing capacity at risk. We know that American workers are hungry to help. They wanted to be part of the solution. In Indiana, one of the towns I represent made history when the General Motors plant in Kokomo, Indiana announced it would be retooling its manufacturing lines to produce ventilators. General Motors Kokomo was the first plant in the country to begin making ventilators in response to COVID-19. Our state health commissioner, and we've all been on the phones with our state health commissioners, Dr. Chris Box, has been communicating with our delegation, keeping us up to speed with what the needs are. But unfortunately, like most other states, Indiana struggled as well. And what we've learned through all of this is that our states must also have their own stockpiles, and they have to continue to do better, and this bill will incentivize them to do that. So I want to thank my colleagues, particularly Representative Slotkin, who has been ferocious in leading this, and Representative Eshoo, who's been at this since 2006, when the first pandemic bill got across the finish line. So I just am proud for all of us to come together in this show of support that biodefense is bipartisan, and we're going to work on solutions together. And with that, I turn it over to Representative Debbie Dingell from Michigan.